Hello everyone, and now after we learn about the autonomic nervous system and how our nervous system is divided, and we learned that autonomic nervous system is divided into sympathetic nervous system and the parasympathetic nervous system. Now we are going to discuss the effect of each system, the sympathetic and parasympathetic, on each involuntary organ. Okay, so you would know the effect of sympathetic and parasympathetic, and if there is exceptions to this effect on this organ. Okay, so let's start with the most important involuntary organ, which is the heart, right? So sympathetic nervous system is the system that is predominant when you are doing exercise. So always keep that in mind, that we are now in exercise or we are in a fight. Okay, so when you are in a fight, okay, you need more oxygen. So you need more oxygen supplied to the skeletal muscles, okay, because you're in a fight. So heart works more, and this would be done through activation of sympathetic nervous system. So there is an increase in the heart rate, number of heart beats per minute, okay? And we call that increase, that this effect is positive chronotropic effect, okay? Chrono is something that, chrono means something related to time, and heart rate is beats per minute, so it's number of beats per time. So increasing the heart rate or beats of the heart per minute is a positive chronotropic effect, okay? Not only the rate of the heart should increase, but also the strength of the beat. So we have an increase in the contractility of the heart. And we call that effect a positive inotropic effect. So positive inotropic is increase in contractility of the heart, while the increase in heart rate is called positive chronotropic. Okay, and the impulse in the heart to contraction mainly comes from the ventricles of the heart. We know that these are the atria and these are the ventricles, atria and ventricles. Okay, so impulse is generated in the atria in a place called SA node or sinoatrial node. We would discuss that in more details later on. And then it's converted to the ventricles, okay? And it's converted to the ventricles through something here called the atrioventricles node or the AV node, okay? So there is a conduction that occurs between the atria and the ventricles through this AV node, and this conduction is physiologically slow, and we will discuss that later on. But for now, we have to know that the signal moves from the atria to the ventricles through the AV node. There is a conduction that occurs here, and sympathetic increase that AV conduction. Okay, and we call that effect positive dromotropic effect. Okay, so sympathetic increases heart rate contractility and AV conduction. It has positive chronotropic, positive inotropic, and positive dromotropic effect. And heart rate contractility and AV conduction, those are all cardiac properties. Okay, so sympathetic increases all increases all cardiac properties. Okay, now for the parasympathetic, you are at rest, so your heart would not work so much as like in stress or exercise. and so on. Okay, so parasympathetic nervous system effect on the heart is the opposite, typically the opposite. So we have negative chronotropic, decrease in heart rate, decrease in contractility, negative inotropic, and decrease in AV conduction or negative dromotropic. Okay, this is there is a very important exception regarding the heart and the innervation of autonomic nervous system. Okay, we have atria and ventricles. Okay, there is no parasympathetic innervation to the ventricles. Okay, parasympathetic only innervates atria. There is no innervation of parasympathetic to the ventricles. Okay, let's now move to the second involuntary organ, which is also very important in autonomic nervous system, which is the blood vessels. Okay, and we know that blood vessels have smooth muscles, and these smooth muscles um, controls the diameter of the blood vessels. Okay, when these smooth muscles contract, there is a vasoconstriction, and when they are relaxed, there is vasodilatation. Okay, so what would sympathetic do to the blood vessels? When you are in a fight, you need the blood to reach your skeletal muscles. Okay, and you don't need too much blood to GIT, for example, or even your mucous membranes. So you need less blood supply to mucous membranes and GIT, and you need more blood supply to the skeletal muscles. Okay, and blood supply, if you want to increase the blood supply, you dilate the blood vessels supplying this area. If you want to increase blood supply to skeletal muscles, you need to dilate the blood vessels supplying the skeletal muscles. Okay, so sympathetic nervous system constrict the blood vessels of skin and mucous membranes in GIT, for example, or blood vessels to the skin, and it dilates the blood vessels supplying the skeletal muscles. Okay, what about parasympathetic nervous system? Parasympathetic nervous system don't supply blood vessels. Okay, it only causes vasodilatation for genital erectile tissue. So erection occurs through the action of parasympathetic nervous system. So the exception here for blood vessels is that there is no parasympathetic innervation to most blood vessels in the body. So ventricles and most blood vessels in the body have only sympathetic innervation. There is no parasympathetic innervation. Okay, so let's now move on to the third involuntary organ, and it is the bronchi. Okay, when you are in a fight, you need more oxygen, so your bronchioles dilates. There is bronchodilation to get more oxygen. Okay, so sympathetic dilate the bronchi, so there is bronchodilation with sympathetic activity, while there is bronchoconstriction in parasympathetic nervous system when it takes the upper hand. Okay, there is a very important exception here. There is no sympathetic innervation to bronchi. No sympathetic innervation to bronchi. And here we have to ask a very important question. How bronchi are dilated in or at the effect of sympathetic nervous system? Remember, sympathetic nervous system acts through the neurotransmitter released from its nerves, which is the noradrenaline or norepinephrine, as we mentioned in the previous lecture. But there is an increase in adrenaline in blood, Where adrenaline comes from? It comes from the adrenal medulla. So under the effect or the action of sympathetic nervous system, there is a release from the adrenal medulla. Adrenal medulla releases mainly adrenaline and small amounts of noradrenaline and dopamine. But there is adrenaline released from the adrenal medulla, and it released in the blood, and blood reaches all the organs. So the bronchodilation occurs from the effect of the sympathetic nervous system is done through the circulating adrenaline in the blood, which is released from the adrenal medulla during the sympathetic nervous system action on the body.